Hello, my name is Alex Jonson, and I'll be presenting our poster on our project aimed at reducing 30-day readmissions in high-risk populations. The basis of the 30-day time period stems from the Hospital Readmission Reduction Program. Instituted in 2012, the HRRP incentivized more thorough patient care through penalizing hospital readmissions occurring within 30 days of discharge. Since its beginning, the HRRP has encouraged many patient trials aimed at minimizing readmission rates by either identifying higher risk patients, establishing resources for more complete outpatient follow-up, or a mix of the two. In a similar manner, a selection of medical students from the College of Osteopathic Medicine of the Northwest partnered with Samaritan Hospital Lebanon to engage with patients and conduct a survey in hopes of identifying barriers to the patient's recovery and working with Samaritan to minimize such barriers. The patients were tracked for 30 days to determine if they were ultimately readmitted and for what reason. Our first case examines a 73-year-old male with a history of diabetes who had been admitted for urosepsis. He had apparently been discharged with a urinary catheter, but he and his daughter, his primary caretaker, expressed discomfort with at-home catheter changes. He was subsequently readmitted with a UTI. Additionally, due to COVID-19, hospital visitations were limited, limiting the patient's ability to see his only source of support. Our second case follows an 89-year-old female with a history of hypertension and COPD who had been admitted for a COPD exacerbation. Shortly after discharge, the patient's oxygen machine malfunctioned due to a power outage. However, the patient had excellent family support, and her son fixed the issue the very next morning. The patient had an uneventful recovery due to her support, and few barriers were noted. Our third patient is a 79-year-old female who is wheelchair-bound and had been admitted for pneumonia. The patient lived alone, and her only interaction with others was by a caretaker who came 3 times a week. There had been unclear communication regarding her discharge instructions at the time of discharge. Additionally, she was isolated even further by a lack of wheelchair ramp in her building. Fortunately, the patient was not readmitted in a 30-day period, but the survey identified numerous ways how the patient's outpatient experience could have been improved. Our fourth case features a 74-year-old male who had been admitted for bowel obstruction. However, due to the patient's status, he was a non-surgical candidate. Ultimately, the patient fell 2 weeks after discharge due to weakness associated with malnutrition secondary to financial constraints. Our last case features an 83-year-old male with a history of atrial fibrillation and gait instability who was initially admitted for bacterial pneumonia. The patient also underwent a fall shortly after discharge. It was later found that the patient used a walker to ambulate but could not get the walker past the split-level staircase. He therefore could only use the walker in half of his home. Though no trend could be established in patient readmission rates, the study was able to identify themes which may have contributed to negative patient outcomes, such as lack of emotional and physical support systems, miscommunication between the care providers and patients, financial challenges, and COVID-19 related challenges. The study initially began in fall of 2019. At the time, pairs of students were able to conduct home visits to patients' residencies, establishing a direct patient interaction and a more thorough survey. However, due to COVID-19, students conducted phone surveys from February 2020 to February 2022. There was a subsequent sharp decrease in patients that were able to be reached. At the point this presentation was prepared, only 12 of the 31 referred patients were able to be reached. As COVID-19 cases continue to fall, it is our hope this study may continue and that students may transition back to performing in-person surveys.